That fasting blood sugar number on your lab report may look small, simple, and harmless, but for many older Americans, it is one of the most misunderstood numbers in medicine. I have seen seniors feel completely calm with a reading that should have started a serious conversation, and I have seen others panic over a number that needed context, not fear. The danger is not just high blood sugar. The danger is misunderstanding what the number actually means, what can raise it overnight, what can falsely reassure you, and why a single morning result never tells the whole story. If you are over 60, this video may completely change how you look at your next blood test. I'm Dr. Michael Joel, and today we're going to break this down in the clearest way possible. Before we begin, please subscribe to my channel, share this video, and join our community for life-saving health guidance today. Because by the end of this video, you are going to know what a normal fasting blood sugar really is, what range should make you pay attention, what range should make you act, and why one tiny shift from normal to prediabetes matters far more than most people realize. And I want you to stay with me because the most important truth is not the number 126. It is the number just below it. Here's the first thing I need you to understand, and I mean really understand. Normal fasting blood sugar is not a gold medal that says everything in your body is perfect. It is one snapshot taken under one condition at one moment in time after several hours without food. That is all. It is useful, important, and often life-saving, but it is not the whole story. I have met seniors whose fasting number looked fine while their blood sugar after meals was climbing too high. And I have met others whose fasting number was slightly elevated, yet with the right changes, they turned things around before diabetes ever took hold. A man named Robert from Columbus, Ohio came to see me after a routine lab test showed a fasting blood sugar of 112. He looked at me like I was about to hand him a life sentence. He said, "Doctor, does this mean I have diabetes?" And I could hear the fear in his voice, the kind of fear that keeps people awake at night. Robert had watched his father lose vision late in life. In his mind, 112 did not mean we need a plan. It meant my future is falling apart. But that is exactly why this conversation matters. Numbers without explanation create terror. Numbers with explanation create action. So let's start with the foundation, the piece everyone should know by heart. A true fasting blood sugar test is done after at least 8 hours with no food or drink except water, not coffee with cream, not orange juice, not a mint, not a midnight snack, not a handful of crackers because you woke up at 2 a.m. hungry. Water is fine. Everything else can change the result. That morning number is trying to answer one question. How much glucose is still in your bloodstream after your body has had a full night to regulate itself? If that process is struggling, fasting blood sugar is often where we first begin to see the warning signs. Now here's the range, and I want you to hear it slowly, clearly, and without confusion. A normal fasting blood sugar is less than 100 milligrams per deciliter. Prediabetes is 100 to 125. Diabetes is 126 or higher, and that diagnosis is usually confirmed with repeat testing on another day unless the overall picture is already unmistakable. That means 99 is still considered normal, but 100 is no longer in the normal range. And yes, I know that sounds almost absurdly close. 1 point. One tiny point. But medicine often works that way. The line matters because it tells us when risk has begun to move in the wrong direction. And this is where many seniors get tripped up because they hear the word prediabetes and assume it means almost diabetes in a dramatic, hopeless way. That is not what it means. Prediabetes means your blood sugar is running higher than it should, but not yet high enough to meet the threshold for diabetes. It is a warning light, not an obituary. It is the body tapping you on the shoulder before it starts pounding on the door. And if you understand that early enough, you can often do something powerful about it. The real tragedy is not being told you have prediabetes. The real tragedy is being told and then doing absolutely nothing. I remember Nancy from Phoenix, Arizona, a 67-year-old retired school secretary who kept saying, "Well, doctor, it's only a little high." Her fasting number was 104, then 108, then 111 over the next year and a half. Nothing dramatic, nothing that made her feel sick, nothing that sent her to the emergency room. So she ignored it. She still drove, gardened, babysat grandkids, and felt mostly fine. But what Nancy did not feel was the slow, quiet strain those numbers were placing on her blood vessels and metabolism. By the time she came back seriously ready to listen, her A1C had climbed and her pattern was moving in a very clear direction. That is how this happens, quietly. Now let me give you the second truth, the one almost nobody explains well. Fasting blood sugar is important, but it does not tell you everything about your blood sugar life. Some people wake up with a number under 100, then shoot far too high after lunch and dinner. Others wake up high, but are relatively stable the rest of the day. That is why your doctor may also order an A1C test, which shows your average blood sugar over roughly the last 3 months. If your fasting number is the snapshot, your A1C is the wider movie. And if those two do not seem to match, that does not mean one is useless. It means your metabolism may be telling a more complicated story. The A1C ranges are also worth knowing, especially if you are trying to understand a full lab report without getting lost in medical language. In general, below 5.7% is considered normal. Between 5.7% and 6.4% is prediabetes. And 6.5% or higher suggests diabetes, usually confirmed with repeat testing if needed. Why does that matter? Because I do not want you to become obsessed with one morning number while ignoring the larger pattern. A senior can have a fasting blood sugar that looks not too bad and still have an A1C showing months of unhealthy elevation. That happens more often than people think, especially when large carb-heavy meals are part of daily life. Now we have to talk about the mistakes, because this is where good people get bad information. If you are supposed to get a fasting blood sugar checked, you must fast correctly. I cannot tell you how many times someone says, "Doctor, I only had coffee," as if coffee is a neutral event. Black coffee may affect some people less than sweetened coffee, but if you added sugar, cream, flavored creamer, or anything at all, you are no longer dealing with a clean fast. The same goes for late night snacking. If you had cereal at 11:30 p.m. and blood work at 7 a.m., that is not the clean 8-hour overnight fast the test is designed for. Details matter because the number is only as honest as the setup. Walter from San Antonio, Texas learned this the hard way. He had labs done after what he thought was a perfectly responsible morning. He skipped breakfast, drove to the clinic, and felt proud of himself. But on the way, he drank a bottled mocha coffee and took 2 cough drops because his throat was dry. His fasting blood sugar came back high enough to alarm him. He called his daughter, convinced something terrible had changed overnight. But what changed was not his pancreas. What changed was the test condition. We repeated the lab properly with a real overnight fast and only water, and the number fell into a very different range. That one misunderstanding could have sent him into weeks of unnecessary panic. But even when you fast correctly, some things can still push fasting blood sugar higher than expected. Poor sleep can do it. Severe stress can do it. Infection can do it. Steroid medications can do it. Pain can do it. Some medical conditions involving the adrenal glands, pancreas, or thyroid can affect glucose as well. And that matters for seniors because many adults over 60 are dealing with several health issues at once. A bad night of sleep before blood work, a lingering bronchitis infection, a recent steroid prescription for knee inflammation, any of these can nudge a fasting number upward. That does not mean the number should be ignored. It means it should be interpreted like medicine, not fortune-telling. And then there is the morning rise that confuses so many people, especially those who already monitor their sugar at home. In the early morning hours, your body naturally releases certain hormones that help prepare you to wake up. Those hormones can push glucose upward. In people with diabetes or insulin resistance, that rise can become more noticeable. Some call this the dawn phenomenon. And if you do not know about it, you may stare at a morning number and think, how can this be high? I didn't eat anything. That reaction is understandable, but your liver and hormones are active long before breakfast. Morning blood sugar is not just about what you ate. It is also about what your body is doing while you sleep. Gloria from Tampa, Florida used to eat a very light dinner, take a short walk, and go to bed feeling proud of her discipline. Yet every morning her home meter seemed to punish her. She would call me frustrated and say, I did everything right, so why is this worse in the morning than it was before bed? The answer was not failure. The answer was physiology. Her body was producing a stronger early morning glucose rise than she realized. Once she understood that, she stopped blaming herself and started tracking patterns instead of isolated numbers. That changed everything, because fear makes people chaotic. Understanding makes them methodical. And methodical people, especially seniors, make better health decisions than frightened people ever do. Now, I need to tell you why high blood sugar is so sneaky in older adults. The symptoms can be there, but they often arrive slowly, quietly, and in ways people brush off. More urination, more thirst, a little more fatigue, blurry vision that gets blamed on age, hunger that seems strange, cuts that heal slower, tingling in feet or hands, moodiness, recurrent infections. Nothing dramatic at first, just a series of changes many seniors dismiss as getting older. That is one reason diabetes in older adults can be missed for too long. It does not always burst into the room. Sometimes it sits politely in the corner while damage slowly accumulates in blood vessels, nerves, kidneys, eyes, and the heart. And please hear this, because it could matter enormously to you or someone you love. Prediabetes often causes no symptoms at all. None. You can feel normal, move normally, laugh normally, enjoy retirement normally, and still have a blood sugar pattern that is heading in the wrong direction. That is why screening matters, especially as we get older. Age itself raises risk. Being 45 or older increases risk. Add family history, less physical activity, extra weight around the abdomen, high blood pressure, abnormal cholesterol, or prior heart disease, and that risk rises further. Many people think they will feel it when blood sugar becomes a problem. That is one of the most dangerous assumptions in preventive medicine. Now let's talk about the other side, because not every problem is high. A fasting blood sugar that is too low can also be dangerous, particularly in older adults taking diabetes medications or insulin. In many people with diabetes, a blood sugar below 70 is considered low and may cause shakiness, sweating, weakness, confusion, dizziness, or even fainting if it drops further. For someone without diabetes, the picture can be more nuanced, but symptoms still matter. I mention this because some seniors become so afraid of high blood sugar that they overcorrect. They skip meals, take medicines at the wrong time, or try extreme diets without supervision. High sugar harms slowly. Low sugar can harm immediately, especially if you fall. This leads to another mistake I see all the time. Someone buys a home glucose meter, checks one morning number, sees 127, and announces to the family that they have diabetes. No, home meters can be useful for monitoring patterns, but they are not the same thing as a formal diagnosis from a laboratory evaluation. Diagnosis usually relies on lab-based blood testing, proper fasting conditions, and repeat confirmation when appropriate. So if your home number is high, take it seriously, yes, but do not turn your kitchen table into a courtroom. Do not sentence yourself in one morning, and do not ignore it either. The correct response is calm follow-up, accurate testing, and a real conversation with your doctor. And when doctors repeat a test, it is not because they are indecisive. It is because blood sugar lives in a body, not in a spreadsheet. Sleep, stress, medications, illness, and timing all matter. That is why a second test can be so important. If your result is normal, many adults can simply continue routine screening over time. If you have prediabetes, you should usually be checked more regularly, because this is the stage where intervention matters most. In medicine, we do not just want to identify disease. We want to interrupt the road that leads to disease. That is why I would rather catch a senior at 103 than meet them years later at 143, after quiet damage has already begun. Who should be especially alert? Adults over 45, certainly. But also anyone with a parent or sibling who has type 2 diabetes, anyone physically inactive, anyone carrying excess weight, especially through the waist, anyone with high blood pressure or abnormal cholesterol, and many people from higher risk backgrounds, including African American, Hispanic or Latino, American Indian, Alaska Native, Asian American, and Pacific Islander communities. For older women, a history of gestational diabetes matters too. I am not listing these things to frighten you, but to wake you up. Risk factors are not predictions carved in stone. They are clues. And clues are valuable only if you respect them before they become outcomes. Now here comes the part I wish every senior heard earlier. Prediabetes is not only common, it is often reversible or at least highly improvable. That is what makes it such an important diagnosis. Studies and prevention programs have shown that lifestyle changes can significantly lower the risk of progressing to type 2 diabetes. In some people, blood sugar can even return to the normal range. Think about that. Not delayed slightly. Not just managed with resignation. Improved. That is why I never want a patient to hear prediabetes as a message of doom. I want them to hear it as a narrow window that is still open. Because if you act early, the body often gives you more cooperation than you expect. James from Grand Rapids, Michigan is one of my favorite examples. He was 71, loved diner breakfast, sweet tea, and pie after supper. His fasting blood sugar was 109, then 114, and his A1C entered the prediabetes range. He looked at me and said, "Doctor, at my age, is this even worth fighting?" That question broke my heart a little because it reveals how many seniors have quietly been taught to settle for decline. We made simple changes. Not punishment, not starvation. Smaller portions, daily walking, better sleep, fewer refined carbs, more fiber, and steady weight loss. Months later, his numbers improved. More importantly, he felt better. More energy, better stamina, less afternoon crashing. Prevention does not just change lab work, it changes living. So what actually helps? First, modest weight loss can make a meaningful difference if you are carrying extra weight. We are not talking about becoming a swimsuit model at 68. We are talking about taking pressure off insulin resistance. Even losing 5% to 7% of body weight can help reduce risk. Second, regular physical activity matters enormously. Around 150 minutes a week of moderate movement, such as brisk walking, is a strong goal for many adults. Assuming your doctor agrees it is safe for you. Third, food quality matters more than people think. Large amounts of refined carbohydrates, sugary drinks, constant grazing, and oversized evening meals can push blood sugar patterns higher. Small, steady improvements done consistently often beat dramatic plans that collapse in 10 days. And let me say something that may save you from a very common mistake, especially if your lab work is scheduled for the morning. What you do the night before matters. A huge pasta dinner, dessert, late night chips, sweetened alcohol, or constant snacking while watching television can all affect the next morning more than you realize. So if you know blood work is coming, give that number an honest chance. Eat a sensible dinner. Finish eating at a reasonable hour. Drink water. Skip the late night kitchen visits. Get some sleep. That way, if your fasting blood sugar comes back high, you can trust it more. And trust matters. Because a number you can trust is useful. A number distorted by avoidable behavior is just noise, and noise wastes time. If you monitor at home, I want you to do it with more discipline than drama. Wash and dry your hands first. Do not test after fruit juice is on your fingertips or lotion is sitting on your skin. Use strips that are not expired. Check at the same time under the same conditions when you are trying to compare patterns. And if you are checking fasting sugar, make sure it truly is fasting, not I only had half a banana fasting. Record the result. Record what time you checked. Record anything unusual like illness, sleeplessness, or medication changes. Seniors who keep calm, accurate logs give their doctors something incredibly valuable, usable information. And usable information leads to better decisions than vague memory ever will. I also want you to stop overreacting to one stray number. If you slept terribly, had a steroid shot, are fighting an infection, or were under major emotional strain, a higher morning reading may not represent your usual baseline. That does not mean dismiss it. It means interpret it like a grown adult with context. What matters most is the pattern. Is this happening repeatedly? Is the trend drifting upward? Is it showing up in both home readings and lab work? Is your A1C rising too? Those are the questions that matter. A single number can whisper. A pattern speaks clearly. And medicine, at its best, listens to patterns, not panic. Now, when should you call your doctor? If repeated fasting readings are landing in the prediabetes or diabetes range, call. If you are seeing numbers of 126 or higher more than once, call. If you have symptoms like excessive thirst, frequent urination, unexplained weight loss, blurry vision, numbness, unusual fatigue, slow healing sores, or confusion, call. If your sugar is going low and you are shaky or dizzy, call. If you are already on diabetes medication and your readings suddenly change, call. Too many seniors wait for certainty before seeking help, but certainty often arrives late. Medicine works best when we respond to concern early, not after months of hopeful denial. I also need to make one careful distinction, because this is where online advice becomes dangerous. The normal fasting blood sugar used for diagnosing people without diabetes is not automatically the same as the treatment target for every older adult already living with diabetes. Seniors with diabetes are not all identical. Some are healthy and independent. Others are frail, on multiple medications, or at risk for dangerous low blood sugar. In those situations, treatment goals may be individualized. Why? Because aggressive control is not always safer control. The goal is not to win a spreadsheet. The goal is to protect the person. And sometimes in older adults, avoiding dangerous lows matters just as much as lowering dangerous highs. So if you already have diabetes and you are watching this video, please do not make the mistake of comparing yourself blindly to someone who has never been diagnosed. Your doctor may set a target range that fits your age, your medications, your heart health, your kidney function, your fall risk, and your ability to manage complex treatments safely. That is personalized medicine, not lowered standards. And for family members listening, this matters too. Do not pressure an 82-year-old grandparent into chasing the exact same numbers as a 42-year-old athlete on the internet. Bodies age differently. Risks change. Wisdom in medicine is not treating everyone the same. Wisdom is treating the right person the right way at the right time. Now let me bring all of this together in one clean, unforgettable summary, because I want this to stay with you after the video ends. Less than 100 fasting is considered normal. 100 to 125 is pre-diabetes. 126 or higher suggests diabetes and usually needs confirmation. Fasting means at least 8 hours with only water. One number is not the whole story. A1C adds broader context. Symptoms matter. Risk factors matter. Patterns matter. And perhaps most importantly, action taken early matters. If you remember only that, you will already know more than many people who stare at lab results for years without truly understanding what they are seeing. But I do not want you to leave with information alone. I want you to leave with perspective, because perspective changes behavior. A blood sugar result is not a verdict on your worth. It is feedback. It is your body giving you information, maybe reassuring information, maybe warning information, but information nonetheless. The wrong response is shame. The wrong response is denial. The wrong response is panic. The right response is curiosity, follow-up, and steady action. Seniors who do best with this are not the ones who never get concerning numbers. They are the ones who respond early, intelligently, and consistently. And that can start with something as simple as understanding what the morning number really means, instead of just fearing it. I want you to think of Robert in Ohio, Nancy in Arizona, Walter in Texas, Gloria in Florida, and James in Michigan. Different people, different numbers, different stories, but one common thread. The moment they stopped guessing and started understanding, everything changed. Fear became a plan. Confusion became clarity. And clarity, especially in health, is powerful. Because when you know what is normal, what is borderline, what is dangerous, and what needs confirmation, you stop swinging between false reassurance and unnecessary terror. That alone can protect you from months or years of bad decisions. And for older adults, those years matter. Energy matters. Independence matters. Vision matters. Brain health matters. The future still matters very much. So here's what I want you to do next. If you have not had your blood sugar checked in a while, especially if you are over 60 or have risk factors, schedule it. If you already have a result, look at it with new eyes. Ask whether it was truly fasting. Ask whether you know your A1C. Ask whether there is a pattern. And if your number falls into that pre-diabetes range, do not wait for it to become a diabetes range number before you take it seriously. That is the trap. Prevention always feels optional until the day it doesn't. And by then, the work is harder than it had to be. Take care of your body, respect the warning signs, and remember this: the most powerful blood sugar number is not the one that scares you. It is the one that wakes you up in time. If this helped you, subscribe to the channel, share this with someone who checks their labs but does not really understand them, and stay with me for the next video. Because the more clearly you understand your health, the more control you keep over your life.